well. Yeah, and so ground rules though is that we must keep patient confidentiality, what we call HIPAA compliance, right? No personal identifying information. And this will also be a safe place to learn and share. And just the note that this is not an official doctor's consultation visit. The purpose is to have a forum for learning and sharing for you. And this is a little bit about Zoom logistics, right? So let's see, we run the series on the third Thursday of each month from 2 to 3 as a 1-hour session. And this is our schedule for the next few months. So you can plan ahead and join us. And let's see, we have here, you can see that today, there's so much to talk about with dementia behaviors that I had to split it up into 2 sessions. So we're gonna talk about that some more. So you can collect even more questions and scenarios for us to share. Next slide. So regarding continuing education credits, any doctors who join us can get CME credits. Nurses can also claim CE credits. Social workers can get CE credits through that social work CME thing. And care home operators can get your required certificates of attendance. And in order to do that, you have to complete an evaluation form to receive your credits. And we will talk about that at the end of the session today, how to do that. Next slide. Okay, so this is just a little introduction to our hub team. And as you see, that's me right over here. And Juanette, you want to wave hello to everybody?
Aloha, everybody. Thank you so much, Dr. Wen, again, for doing this for us and our support team that's on the call today. Have a great educational in-service today. Thank you.
Thanks. And Maribel, you want to say hello?
Hi, everyone. And tonight, I just want to remind my AFA family that we will be having our general membership too via Zoom tonight at 8:00 p.m. So don't forget to join us. And thank you for joining ECHO every third Thursday of the month. Yeah, thank you.
Okay, and we have Juliana from Aloha Care.
Hi, everybody.
Hello.
Hi, everyone. Thanks so much for joining us today. Thank you, Dr. Wen.
Yeah, and we have Jane. You want to say hi?
Hey, aloha, everyone. Welcome. Enjoy.
Great. And actually, we have a special guest here today, too. We have Ivy Castellanos from the Alzheimer's Association.
Good afternoon, everyone. Thank you, Dr. Wen, for the invitation.
Yeah, because Alzheimer's Association is definitely another resource that we can all use. So great. Okay, so let's go ahead and get started. We're going to talk about our topic today, which is preventing dementia behaviors, part 1. So let's see. Next slide. Okay, so today we're gonna review Maslow's hierarchy of needs. We talked about that last month when we talked about crisis management of the behaviors. And then we're gonna cover practical approaches. So connect in 3 ways, ABC approach and 3 Ps. And we're gonna cover 2 of Maslow's hierarchy. So that's gonna be addressing physical needs and safety needs.
Okay.
While we do that, we're going to discuss challenging scenarios that are common in those 2 arenas. And next month, we're going to be covering the next 2 parts of Maslow's hierarchy. Next slide. Okay, a little bit about, just a reminder about dementia behavior, dementia basics. Next slide. As you know, dementia is not just memory problems, right? Dementia involves memory, but it has other brain functions as well, like judgment, planning, emotions, language, every part of the brain. Next slide. And so because it involves the entire brain, it causes problems with function. They have trouble doing complex tasks. They have trouble doing everyday tasks, which makes them frustrated. That's kind of what they're coming from. They're frustrated. Next slide. And dementia also causes problems with behaviors. And so they have difficulty with behaviors and relationships, and has a lot of misunderstandings. So it's important to know that. So the question is, what dementia behaviors do you deal with every day? Let's just click ahead, John, just click, click, click. So there's repetitive actions, wanting to go home, easily frustrated, abusive, right? They hit you, they punch you, kick, right? Irritable, accusing you of stealing things. Anybody raise your hand? Got everybody seen all these things, right? Oh, resistive to bathing. Oh, all the time. Restless. Oh, repetitive, calling out again and again, all the time. Aggressive, right? All of these things are very common. Screaming, right? Screaming. And so it's not just a one-time thing, right? This is everyday things, right? So that's why we're talking about prevention, because we don't want to deal with this every day. We want to prevent whatever we can. Okay, so I'm just going to cover a couple of real basic things to get us started with. So when approaching somebody with dementia, it's important to connect in 3 ways, right? Visual, verbal, and touch, right? Visual, verbal, and touch, 3 ways, right? Visual meaning you come in the front, they make sure they see you, they know you are coming, you're not taking them off guard, doing surprise them. You're coming, you see them, you wave hello, and you stop 6 feet out and say hi, wave hello, make sure they see you, maybe offer your hand or offer something, use your name, introduce who you are, and make sure they are welcoming you into their space before you proceed with anything else. So no surprises, right? Hello, you see me? And then verbal is by introducing yourself and asking for permission to come talk to them. And touch, that's the last one, right? Is where you hold their hand, get to the side. So you're not confrontational, you're not confronting them. You get low, so you're not intimidating them. And be friendly. Say something really nice, compliment them. Nice hair today, love your shirt, you're so bright, right? Say something nice and then wait and see what kind of reaction you get. So this is just starting off on the right foot, connecting in 3 ways. If you start off, well, how many of you have started the day off wrong, right? It takes a while to correct, right? So you want to start off right. And that prevention, that's part of prevention, starting the day off right, the relationships off correctly. Next slide, know your ABCs, right? What are the ABCs? So A stands for antecedent. That's the fancy word for saying, what happened? What just happened? Just before it happened, at the time that it happened, who's around? What were they doing? Where are they? What time of the day is it? Why did this happen? What are the possible triggers? So you think about it and you say, who, what, when, where, why? What is going on here that precipitated this, caused this behavior to happen, right? So antecedent is A. B is behavior. That means, what is the specific behavior? It's not just, oh, they're agitated. That's not helpful, right? What's the specific physical behavior? What's the specific verbal behavior? So what are they actually saying and what are they actually doing? So being specific. And then C is consequences. That means what happened after this behavior? How did people react? Did people get hurt? Could we have done something differently to change the consequence? Right? Did we make things worse by jumping in and telling to stop? Or, what could have, should we not have scolded them, or, And so the purpose of ABC is to help us think about possible causes so we can prevent the situation from happening in the future, right? So hopefully this is about learning from the past and, doing things differently in the future. So know your ABCs. Next slide. And then plan with the 3 Ps, right? So what are the 3 Ps, right? So if you click on it, John, it'll show you. Oh, okay, keep clicking. Okay, prepare, prevent, and be present. So, for example, so it's Tuesday, 2:30 in the afternoon. The home comes very busy and noisy. Mr. Wong starts cursing, pacing, and going to other rooms, and the resident starts yelling at him, and he starts yelling back, and it's a whole zoo next, right? So he starts by cursing, pacing, wandering into rooms, right? So what do we do in the future, right? Click again, John, right? So prepare, maybe have his favorite snacks available for distraction as needed. Have a buddy help you distract him in case it's needed. Prevent, right? Click. And so don't have the resident near the common area around this time of day, maybe, or plan an activity before the kids come home from school so that you avoid this overstimulation, right? By preventing this from happening. And the next is be present with him. Make sure somebody's there to walk him through this very challenging time, acknowledge his frustration, listen to him, and then walk him and lead him to a quiet area for his favorite snack or activity, something like that. So that's what I mean by the 3 Ps: prepare, prevent, and be present. So that's the strategy. That's the overall strategy. And then you have to have a bag of tricks, right? Because you don't just have one trick, right? You have to have lots and lots and lots of different strategies. So it's like Felix the cat here, right? So we can talk about some of that next time. Okay, next slide. So that's part of preparation, right? Being prepared. Okay, and so now I'm going to talk a little bit about reminding you. Does anybody remember this Maslow's triangle? We talked about this last month, and we talked about how when somebody has behaviors, we have to become a like detective, like this guy over here. He's a detective, and he's got to think, what are the needs? Because persons with dementia have unmet needs and they can't express it. They can't figure out how to express it. So that's why we have to figure it out for them. The basic needs are physical needs. You know, are they having pain? Are they hungry, thirsty, cold, constipated, tired, right? So we need to pay attention to those. And what you do when you look at it, you have to go in with that Sherlock Holmes and think ABC, who, what, when, where, how, why, ABC, and then think about, now, if I figured out what the circumstances are and everything, how do I make the 3 Ps, right? Right? Prepare, prevent, and plan, right? And be present, right? And then basically create a plan. So, and then we're also going to be talking about today are the safety needs. Having an overstimulated environment feels very unsafe, right? Life is just too overwhelming for them. They don't feel safe, right? Or anxiety. They're worried about stuff and they don't feel, they know what's going on, right? So it makes them anxious. It's not a safe feeling, right? So these are just some of the things we're going to focus in on today. Are we ready for some cases? Yes? Okay. All right. So anticipating basic needs, right? We talked a little bit about that. It's like toddlers, right? They don't know exactly what's going on. Like suddenly they are just crying or acting out. And then come to find out, oh, they're just hungry. Or you come to find out they just need a snack. I mean, they just, too tired, they need a nap, right? Okay. So here's a challenging scenario, number 1, right? Case scenario, resistive to personal care. So John hasn't been the same since he slipped from his chair 2 days ago. There are no obvious injuries, and he was able to walk after that. So you're like, okay, so he can walk, no big deal, this is great. However, after that, he's been more irritable. He's been refusing to get out of bed, and he pushes you away when you try to help him, and he yells at you to leave him alone. So your first thought is ABC, right? What's going on? What happens when this behavior happens? What causes this behavior? Right? Well, happened 2 days ago, right? When you tried to get him out of bed. After a fall. Do you think he might be in pain? Possibly, yeah. Because when you try to do stuff with him, he pushes you away and he's yelling. Of course, he doesn't know why, but he doesn't want you to hurt him, I guess, right? And so what happens if you actually go away? He doesn't get the treatment he needs. He doesn't get the care he needs, right? He just lays in bed. That's not really a very good scenario, right? So we got to change that. So if we think that's what's going on, we got to read his mind, right? And we think, okay, now let's plan so that we can avoid this, right? So one possible plan is maybe give him, well, you could talk to the doctor and you can ask them what they think. Maybe he needs to be seen, right? For pain, maybe he has something going on. Maybe he twisted something. I don't know, right? But maybe Tylenol in the morning might not be a bad idea. And then move him about 1 hour after the Tylenol. And or, you could gently talk him through each motion, right? Instead of just going in and grabbing him, you say, yeah, I know you're a little sore. I know it's a little bit after you fell, things are kind of tight here, we'll go slowly, come, let's do this 1 step at a time. I'll help you. Don't worry about it. And just talk him real gently right through each movement, So, and then something like that. So that's the approach, one of the approaches. Next slide. Okay, so now it's your turn, right? Because I don't have the answers here, right? Okay, Anne has screaming episodes every 3 days or so, and sometimes this can go on for hours. And she is inconsolable, just screaming. And everybody's ears are, breaking, right? You're gonna cover your ears. This is usually relieved after having a large bowel movement. Huh, what is going on? I want people to put in the chat box, raise your hand. Tell me, what is going on with Anne? What is going on with Anne? Constipated. Constipation, right. All right, so what do we do to plan ahead so we don't get there? Because we don't want to do screaming every 3 days. Prune juice, suppository, stool softener, yeah. Right? Fiber fluids, right? Go for Miralax order, exercise, right? Move things, move your body, move your bowels, right? Papaya, yeah, I love those non-medication treatments, especially the papaya and the prune juice and fiber and fluids, good. Even toileting after breakfast, right? Or report to the case manager if the resident has one, of course, yeah. And maybe even, yes, water, provide reassurance and distraction while in it. Sometimes, it's kind of feels weird. I guess if you have dementia, you don't know what's going on. Having a PM kind of be weird experience. So maybe just being there, provide reassurance and distraction while they're on the toilet. Yeah, you're going to have to just sit with them and be present while they're going through the distress and walk them through the distress. And maybe they'll make it through not so bad. Very good. Great. Great answers. Next scenario, let's see. Actually, this is not a scenario. This is safety. Okay, so if you can't see well, anybody here wear glasses? I see lots of glasses, right? Now take your glasses off, right? How do you feel? You feel safe or you feel unsure? You feel a little unsure. Yeah, and what if you can't hear clearly? You feel unsure? Yeah, hard to see, hard to hear, not sure what's going on. Maybe they're talking about me, I don't know. Right? And what if you don't know where things are? Like, where are your socks? Right? And you don't know what time it is. You have no idea, right? You're kind of lost in this world and you feel like no anchors, right? So, and that, have you ever been in like a foreign country where you don't know the language? Right? Yeah, you want to be with somebody who knows what's going on, right? So it doesn't feel safe and it's frustrating. So, yeah, so imagine a lot of these folks, if they can't see or hear, they're frustrated just by being there, right? And so pay attention. If they have glasses, they're not going to be able to ask you. Make sure you provide it, right? If they're hard of hearing, do what you can to help them get the hearing aids in, use a pocket talker or talk right in front of them, make sure it's nice and clear and loud, right? Things like that. So yeah, we don't want them being disoriented. We don't like being disoriented for sure, right? So making a safer environment. Next slide. Okay, so here's a rampage. It's 10 in the morning. Grandma is on a rampage. She started emptying all her dressers. She's looking for something, and now clothes are all over the room. Now, she doesn't even remember what she was looking for. But now she's mad at you because you stole her glasses and you are always touching her stuff and misplacing things. What's going on? ABC, give me some ABCs. Maybe she's looking for, maybe she can't see, right? Have you ever tried looking for your glasses without your glasses? I do that all the time. It's hard. Right? So what's going on? She's mad. Yeah, she's mad. She's frustrated. Oh, yeah. Tired. Maybe, yeah. Not having her teeth in her mouth because she's looking for stuff, right? She's looking for something that's not quite right. Yeah, could be dentures for sure. Anything. Tired eyes, could be. So yeah, so what's happening right before this is that she's emptying everything because she's looking for stuff she cannot find. So maybe, so how would we plan so that this doesn't happen every day? I mean, you got to clean up after her, right? You want to be cleaning up after her every day? Putting her drawers back together? What are we going to do to plan? You had a patient who packs a suitcase and looks for a cab every day. Right? So redirecting and reorienting, that's part of being present, being there. But let's see, what can we do to prevent her from taking apart her drawers? If she's looking for something specific, if she can read, sometimes they can still read. You'll label the drawers and say, oh, these are the shirts, these are the pants, these are the whatever, right? Or you could keep her busy and distracted with something else so she doesn't start thinking that she's missing something, right? She has everything she needs. And you could also help her save face, and you could just help her look instead of have her keep on frustrating and throwing all the stuff on the floor. Help her look. He goes, oh no, you're missing. So I lose things all the time. Let me help you. Is this what you're looking for? And then you can start distracting her. Say, oh, what's this? This was your favorite shirt. Oh my goodness. I was looking for it a long time. Do you want this? And then all of a sudden you can be present with her, walk with her, distract her, and help her get out of the room into another activity. And voila, you're out of that situation. So yeah. Have an activity before 10 a.m. if this is her daily routine. That's right. That's part of preparing, right? Preparing and planning and then being present. Because once she gets into this, you've got to be able to walk her through it, to walk out of it. Help her walk through it and walk out of it. Great. Okay. Let's see. Next slide. Safety. A calm, a comfortable, and a safe environment. So sometimes a little challenging to come by, but if you can find a quiet room, it goes a long way, right? If you go into a noisy room, all kinds of things going on, sometimes it's just too much, right? So a calm, safe room. And, even something like a fish tank, right? Or, koi fish or something. It's very, very gentle, very soothing and calming. So anything that can get into calmness in the environment is something that helps them feel safe too. Yeah. Okay, let's see. Next slide. Let's think about this. Nana, she's watching the afternoon news. And what's on the news? The pandemic and wildfires and protests. And then she begins banging on the table and calling out for you every 5 minutes. And when you ask her what she wants, she can't tell you. She just wants you to sit down with her. What is going on? What do you think is going on? ABC. What is the activity? What is the antecedent? Overstimulation. Yeah. I'm afraid of the news. I would say the news is kind of frightening. What else? Worried about what's going on. Maybe she's scared of the news and she's anxious and worried. Sundowning, that's right. Oh, she's getting physical, right? So her behavior is she's physically banging. And then she's also has verbal behavior. She's calling out every 5 minutes. Just turn off the TV, change the channel, for goodness sakes, right? Yeah, so that's right. So if we can figure out, you got our detective hat on, right? We got our detective glasses. We've got to change the plan. So what are the 3 P's? What are some of the P's? Happy channel. Good idea. Happy channel. Jeopardy is a happy channel, yeah? What else is happy? Game show. Yeah, game shows are fun. TV land. Maybe cartoons, yeah? I don't know. Babies, animal show, right? Everybody loves Wheel of Fortune, huh? And Jeopardy. Okay, so yeah, plan a different activity. Stop the TV and address her feelings and provide reassurance, right? Switch to calm music, right? Yeah, and maybe, we got a resident once and he was a veteran and we were told explicitly, do not put on the news. Do not put on the news in front of him. Yeah, so when I saw that somebody would turn on the TV and put on the news, I said, no news. No news. This is what's going to set him off. Right. So got to pay attention to all this sort of stuff so he feels safe. And then address her feelings. You know what? If she sees the fire, say, you know what? Don't worry about the fires. The firefighters, they came. They put out the fire. It's all set now. Everybody's safe. Don't worry about them. The infection, oh, they treated it. No problem. Don't worry. It's okay. Whatever it is, lots of reassurance, calm activities, switch it and do something happy, right? Reassure her that she's safe, she's with you, you're with me, everybody in this home is safe, right? Don't worry about it. Toilet her. Yeah, is that a distraction activity? That's possible too. right? Get her a snack. So you have to prepare, right? Plan and prepare. Well, and prevent, right? So prevent is, of course, don't turn on the TV anymore, not on the TV channel, not on the news channel. Prepare some pleasant activity that's fun, right? And then address your emotions. So those are all great strategies for prevention. So you don't have to do this. You don't have to have this happen again. Oh, a tablet for my patient. They played the bond dance for him, which is very interested in. That's a great idea. Everybody's different, right? And everybody has different triggers. So it's good to know each person's special piece of themselves. Yeah. Here's another scenario. Tata. What's with Tata? Sister and family with 3 kids have flown in to visit dad. You have a nice feast outside for the big family reunion. That's a great thing to do, right? Family reunion. But during lunch, Tata becomes very grouchy, demands to go back to his bedroom and refuses to come out again. Sister is upset, but dad waves them away. What's going on? What's going on? What happened right before he got really grouchy? Right? He's not used to having all these people visiting. I mean, sure, it's his sister, but you know, is that too much? Too many people. Loud kids. Yeah. He hasn't seen them for a while. He may not know who they are. Right? We could have done a different job, right? Planning for this thing, maybe. Right? What would you plan next time if you saw this? Well, first, we got to get him out of this thing, right? Better planning is needed. How would you plan? How would you plan next time? Yeah, maybe just 2 at a time. Family pictures, limit the number of visitors, prepare the resident, maybe practice before they come. Not everyone at the same time. Video call before the visit. Turn down the voices. Yeah, right? You can always tell the kids, Tata's ears are sensitive. Too loud, he doesn't like it. Right? Nice and soft and big smiles, right? Instead, right? So preparing the family and preparing the resident, right? Long before the event, start to reorient him and introduce the pictures. That's a great idea. Because they knew they were planning. They bought the airline tickets, for goodness sakes, right? They knew they were coming for a while. Yeah, especially, right? And so maybe not everybody has to come the same day. In fact, maybe somebody could come in the morning and somebody else can come in the afternoon. Right? Good. Yeah, you guys have good ideas. Oh, yeah, show your excitement for his incoming visitors. They must love you so much. They came so far away to see you, right? That's fantastic. Yeah. So those are ways to plan, right? The 3 Ps. Prevent and plan and to be present, right? So, because you're familiar with them. So maybe you should be there too and provide reassurance while they're there. Maybe instead of limiting visitation, encourage relatives near to visit often, even a short time, right? Because if they see, they're more familiar to recognize the face again and again. Yeah. All very good. Very good. Okay, so let's see. Gentle sensory stimulation. So this is also something that's very helpful. People have found that if you provide gentle sensory stimulation, it could be actually quite enjoying and, enjoyable, can be more happy, more content, and less bored or inactive. So you're not just, if you do nothing, you fall asleep and nothing's going on and you're not very happy, just bored, right? But if too much stimulation that they can't handle, but something gentle is something nice in between. So that is a good activity. So next slide. So another idea is something like Namaste Care, which is basically gentle sensory stimulating environment. So very quiet and safe environment with soothing sounds, gentle touch, gentle sensory stimulation. This is a video with fish swimming on it, or sometimes you can do like waterfall or family or animal show or something, gentle, nothing violent, no adventures, just very gentle and calm environment and good gentle. Next slide. Right, so part of this is if you put them in a comfortable lounge chair, you have gentle touch, very safe. You have a quilt or a blanket tucked in all around them, lots of pillows for repositioning, towels, lots of attention to personal care. You can brush the hair gently for a long, long time. Video, nature videos, music, talk about memories, maybe do some range of motion, gentle range of motion, stretch those arms and bend them again, foot washing, hand massage. Just those are things that I often like to teach the families to do. Some families, they don't know how to interact with their family member with dementia. They talk to them and they can't answer and then they go away, right? Not a very nice interaction. It's depressing. They don't like to visit. But if you teach them and you show them, hey, sit down here, this is what you should do, maybe brush your hair, maybe massage the hands, that kind of thing, and you could teach them how to provide this gentle sensory stimulation. So next slide. So for example, a gentle Adl Care, right? Soaking the fingers, right? Soaking the feet, little massage, right? Those kinds of things. And you could teach families how to do that too. Caregivers, you guys can do it, but also families can do it and everybody can. It's just high touch, very gentle. And that creates this very calm environment that we're talking about. We want them to feel safe and comfortable. Next slide. Okay. Soft touch. So if you have a little soft, even if it's a stuffed animal to hold, right? Soft touch, birds singing, soothing sounds, right? Next slide, right? Even sucking on a lollipop is very nice, right? Very sweet. People like sweet things. Massage. It doesn't have to be a professional massage. We're not talking about professional. We're just talking about gentle touch, right? And that's enough for feeling comfortable, comforted, and soothing. Okay. This is something from the Netherlands, New Zealand, and they have this multisensory environment thing where you have squishy toys or red, colored bubbles or, textures to touch. This is a fiber optic cable. And, people with moderate to advanced dementia, they enjoy these kinds of things. You cannot fail with these activities. These kinds of activities, they're just nice, and they're interesting. So those seem to be, very helpful for just keeping people calm and happy. And music therapy has the most evidence for effectiveness. So when people did studies, they found that when they did music therapy twice a week for 6 weeks, the overall levels of agitation and anxiety and depression and behaviors went down. And most of the studies had music therapy 2 or 3 times a week, and they usually had a protocol. But, a lot of music. Music hits something very, very deep in the soul that is very different than just, the cognitive parts. And so it's very, very effective for managing behaviors. Let me just see here. So what is, so actually, before we go to that, so what music therapy is specifically is, you go through a protocol where you warm up, you start a well-known song, then you have the patient interact with you. They're either clapping or tapping or singing or dancing or moving, So it's not just music playing in the background, it's music that we interact with. That's kind of the crux of what musical therapy is. It's not just music in the background that they like, but it's music that they know and they love, identify with, and they interact with. And that's what we're talking about when we talk about music therapy. Next slide. And just wanted to show this about iPod music and memory program, right? So they took this program where they personalize the music playlist, just like their favorite songs they know, the musical favorites. They tap very deep memories and they can bring the residents back to life, right? So, go back to the family and say, what was their favorite kind of song? They like Hawaiian, yeah? Okay, let's get a playlist. What's a favorite Hawaiian song, Let's put that one on their playlist, right? And play it over and over and over again, right? Those kinds of things. Yeah, next slide. Okay, so actually, I'm gonna just go back to the music thing. So I just want to see what people want to share about their experiences with music. Do people have experiences with music being an effective treatment for agitation? I see here, Liberty Albano says binaural tones. Do you want to explain that to everyone? You can unmute or type. Wynette or Arlene, you want to talk a little bit about your experiences with music therapy? Soft music.
Yeah, we let the radio play throughout the day or CDs, Hawaiian music in the background in our activity room.
Yeah, it creates a calm environment, right?
Absolutely.
Right, I have to make that safe environment. Oh, harmonica. Oh, I had a lady come in once a week for music therapy and stimulation. Yes, sometimes, music therapy, they're trained to actually, as they interact with the residents, they can change their approach and change the music and try to adjust to try to bring out the best in them, So it can be quite nice, and it can sometimes really help even with physical therapy, with movement. Parkinson's disease patients, they walk better or they move better when they have music or rhythm going, right? Korean instrumental music, ukulele, yay, playing and singing. Oh, that's beautiful that you play music for the residents. I bet it's a happy home. And they have their own radio. I think the more music, the better. And that's what the studies show. They took medical studies, right? And it shows that music is the best therapy for behaviors. It's really quite effective. Classical guitar, right? Everybody's different, right? Different people have different deep memories and different experiences from their lifetime. So this is a little bit of a summary where we have physical needs, right? We can anticipate and prevent these. Safety needs, like being overstimulated or anxious, you can create a really nice environment for them. Pay attention to their physical needs and creating that really nice environment. And then next month, we're going to talk about love, belonging, and respect, as well as creating a meaningful life as other interventions for prevention. But this is kind of what we focused on today. And then I wanted to just introduce Ivy here to just talk a little bit maybe and ask you what your thoughts are. You know, the Alzheimer's Association, they are, actually, John, I'm going to get to those slides later. Just hold on with that. Yeah. So I don't know if Ivy, you want to ask a few questions. Actually, Michaela, do you have the little survey thing? We were wondering if you guys think it would be helpful to have like a support group for care home operators for behavior management, because the Alzheimer's Association does this for caregivers in the community, and they have other resources as well. So if you could sort of fill out this poll, and then I'm going to have Ivy from Alzheimer's Association to speak to you a little bit.
Great, thank you, Dr. Wen. I see the poll up here, so I guess we'll give everyone a little bit of time to complete this. But you know, I'm actually just hoping to offer some additional resources and support through the Alzheimer's Association as all of you care for your residents or patients. And today, you know, we're really just trying to gauge everyone's interest and learn a little bit more maybe about what might be helpful. So, Michaela, how are we doing on the poll?
John's running the poll on his side.
Okay.
I think give him a couple more minutes, then we can see.
Does everybody see the poll on their screen? If everybody does, please
Yes.
answer those questions. That's awesome. Great.
So, you know, the first question about support groups, the Alzheimer's Association, we've been offering support groups for family caregivers, you know, for a long time. And we just wondered whether it would be helpful to maybe convene a group specifically for professional caregivers. So that's the one question. And then the second, again, just wanting to learn, you know, what would be helpful for everyone. We have, you know, these resources and information, a lot of which now, you know, we can send electronically and share with everyone. So just curious to see what your thoughts are.
There's a question about if the support group would be in person.
Oh, that's a good question. You know, through the pandemic, we've been delivering everything virtually. But you know, in the next couple of months, we're going to be transitioning back to in-person engagement. But we've seen that, you know, things can work really well virtually. Sometimes people find it, you know, a little more convenient to meet this way. So we're certainly open to seeing what the consensus is.
Great. Okay. Okay. Next slide. I have a quiz for you. It's not really a test. Who remembers, what are the 3 ways to connect? Let's see if I can get any responses in the chat. What were those 3 ways to connect? When you see a patient, start them off on a good day. Anybody? Visual, verbal, touch. Yay, okay, good job. All right, visual, verbal, touch. Yes, everybody's got that. Okay, good. Come from the front, visual, verbal, touch. Right, and repeat that again, visual, verbal, touch. You guys got it, good. Next slide. What are the ABCs? What were those ABCs? Antecedent, behavior, consequences. Great. What happened before? What is the behavior now? And what happened after that? How can we prevent the consequence? Antecedent, behavior, and consequence. That's right. Yeah, you got the next one. Prepare, plan, and be. That's the next slide. Next slide. The 3 Ps, right? Prepare, plan, and be present. Okay, so you guys got today's lesson down really, really well. Okay, next slide. Okay. Oh, what were some of the strategies in the bag of tricks we talked about? Redirect, the 3 Ps. Redirect. Prepare. Okay, great. You guys are good. You've learned a lot. Looks like 87% would be interested in joining a support group if it was specifically created for you guys. And that you would be interested in brochures, pamphlets, online resources, training, support group, and consultation.
Oh, great.
Yeah, so this is great. Thanks so much, everybody. I think this is really helpful. And Ivy, if you don't mind, you can join next week too.
That would be great. I would love to.
Yeah, because we're gonna do part 2. So that would be fantastic.
Great.
Yeah.
I just included my contact information and a link maybe that folks can check out if they're interested, but I listed our chapter phone number and website as well as my email address if anyone wants to reach out and coordinate either materials or maybe talk a little bit more about a potential support group. So thank you.
Great. Next slide, John. Okay, an ounce of prevention is worth a pound of cure. Yeah, that's the slide I wanted to leave you the last thought for the day for that one. And I'm really proud of all of you. You guys have lots of great ideas. And yeah, to start thinking about prevention and preparing and doing what we can so we don't have to have frustrating behaviors every day. And you actually might enjoy each other a lot more. So good. So I'm just gonna, Michaela, do you want to talk about evaluation?
Yes, hold on. I'm going to put the link into the chat box right now so that everybody can pull it up, and then I'm going to be sharing my screen and walking through it. So there's the link for everyone. You can either press on that or you can type it into your browser. Now I see that somebody's asking for a copy of the slides. We can put the slides up on our website, and I can put that link in to the box as well right now so that everybody can visit the website. We put the recording of this training and the slides up in our resources section on the website every month. So there's the link to the website where you can find the recordings and more information. And then there's also the link for our evaluation. Here, I'm going to share my screen so that everybody can see this evaluation. We're going to walk through it just real quick. Now, every evaluation has to put an email, and every evaluation has to enter a name. You have to put one name per evaluation. Every person that watches this and wants a certificate of attendance has to do their own evaluation. We do it this way because we have an automated system that sends out certificates of attendance. And if you put multiple people down on a form, it's not going to be able to send it to you correctly. So put your full name and one name per evaluation. You can put down the same email in every evaluation though. So if you have multiple people watching from one household, you can put one email and then just keep coming back to complete the evaluation for everyone. Put the date of the session, tell us if you're connected with an organization so we know who is calling in. And then with the kind of certificate that you want, if you're part of a care home or as if you do not have an MD or an RN, please select certificate of attendance. And well, that's how the system sends it to you. And then you just fill out the form. At the bottom, if you could give us any feedback on what future topics you want to see on this, it really helps us with our planning purposes. And you can email John or I at any time John's name is that email's at the bottom of the form, and you can find my email on the website. Now, if we go to the website, I can also show you around there a little bit. Let's see, you should be able to see this one here with me. So here's our website. You can find the registration link at any time here. If you want to submit a case presentation, if you're seeing a difficult situation going on at the house that you want us to cover at the next month's meeting, you can fill out this online form. Just make sure that you keep everything HIPAA compliant. So don't put names, just put generalizations, and we'll review it and address it at our next meeting. The evaluation link can be found in our evaluation tab at any time. A list of upcoming echoes can be found here. The echo recordings are added here. You just hit the little plus button and you can see that it's here. And we add any resources and a little how to Zoom if you need any directions on there on our website as well. That's all I have for you guys.
Yeah, we have a question in the chat, how to find the evaluation form.
The evaluation form can be found on the website, or it can be found at this link. Hold on, let me send that again. So it's tinyurl.com/ch echo eval. CH is care homes, echo eval. You can click on the link or you can type it into your browser. There's some other attendees that messaged me directly just for our records.
There is a question, if you watch the recordings afterwards, will you get a certificate, assuming that you've completed the evaluation as well?
You can get a certificate of attendance. You cannot get certificate of medical education. So if you're an MD and RN, you have to watch live. Okay, somebody wanted the website again. I can copy the link for you. It's actually on the flyer too. There's a tiny URL. You can type in this. If you want a shorter URL to type in, you can go to I tried to make smaller links for everybody so that you can access it easier typing it in. So it's ch-echo-info. So care home echo info for the website as well.
Or could I go to the evaluation again?
The evaluation, sure, I can type it into the box again. The eval one is the evaluation. The info one is the website.
I have a question.
Yes.
From May in service regarding COVID vaccination, it says on the flyer that our clients are not allowed to go out to any function regarding or any gathering with the family. Are they okay to, are they allowed to go out now since families are calling to take them out for lunch or dinner?
You know, we can't stop them from doing that, but it's not advised be based on what's safe. You know, I think if they're going to go to an indoor restaurant, that's probably not too safe. But if they're going to outdoor restaurant, it's probably okay. You know, it's we prefer people to be safer.
Yeah, because my client birthday is coming in a week, and they're calling me if they can take her out. So I told them, since I texted the flyer to them couple months ago, and they're calling if it's okay now. So I told them, oh, I'll get back with you guys because we have an in-service Thursday. Then I can ask that question.
I wonder if you could, I don't know, be creative and try to do something at the home for them with the family.
I suggested that they can just bring the lunch, or they can bring something for the mom, and I'll prepare like a small table in the garage for them or in her room. For them to get together. Yeah.
I mean, that is always safer because if you go out, you don't know. I mean, you may be vaccinated and your family might be vaccinated, but the other people in the restaurant, who knows?
Yes, I explained that to them, doctor. I mean, ma'am. So that's why, you know.
Yeah.
Yeah.
Well, see if you could.
Okay, thank you. And also, I didn't get our certificate from the last in service yet, so I'm not sure who I can talk to about that.
If you email, go to the end of the evaluation, email John your names, he can check into why.
Okay. Okay, thank you so much. Thank you.
Yeah. Oh, there's a question about, are you connected with an organization, yes or no? The names of the business we work for, like ARCA, that's an organization. That's fine. Or your care home.